Hello and good morning. Today I shall be discussing about citicoline. And citicoline is a molecule that has a big market, around 500 tons per year. This molecule had generated deep interest in several pharma companies since a long time. All the pharma companies who tried to make this molecule have been following essentially the same synthetic scheme and a similar process. However, most of them have not been successful in spite of having a process in hand, and there have been several reasons for that. First, I believe is they fell into the greed of short synthetic route for this molecule. It has only two steps. However, later they realize that finally, when this process is taken to plant, it requires around 18 to 20 equipments at plant for continuous production. And another is the greed of available pirated process, which is available all over India. We drove these companies to take up the product, assuming that this would be a quick product for development and development cost would be eliminated. But little did they realize that mere possessing a process doesn't guarantee the depth of the technology that is required. And this molecule is a sensitive molecule and it is very sensitive to temperature and changes in pH. The impurities which form here in this product are not easy to remove, and this product also requires a team dedicated specially to this product at plant. You cannot keep changing the team members from a different product to this product. Otherwise, a minor mistake can cause the impurities to form, which cannot be removed in this. Another challenge which keeps coming regularly in Citicoline is the Citicoline coming from Chinese markets, which is very cheap. So there is always a pressure of cost on this product, and have been several non-GMP facilities who wish that they would be able to produce this product of the quality of USP grade or a very high quality grade of API, and they expected that to be produced at a price uh, of the product that is available in the Indian market, and they failed to upgrade their facilities and to qualify for the regulated markets. And current manufacturing cost for this API is around 4,000 rupees per kg in the Indian market, and from China it is available very cheap. So what Indian manufacturers are currently doing is procuring the crude material from the Chinese market and do a purification by carbon treatment and isolate the product by crystallization and sell it in the Indian market. So there are challenges in the production of this API, and the first challenge is the insolubility of the raw materials in any solvent other than water. So no other solvent than water can be used for the dissolution of this product. So that is a challenge because water is not a suitable solvent because this is a coupling reaction with DCC. Stability of citicoline also poses a challenge because once the product citicoline gets formed and during the subsequent isolation procedures and workups, the citicoline keeps converting slowly back to the cytidine monophosphate raw material itself because this reaction is reversible in aqueous condition, and that is an impurity which poses a challenge for its removal. Also, in presence of DCC, the cytidine monophosphate reacts with methanol. Methanol is a solvent there to produce cytidine methyl ester impurity, citicoline monophosphate methyl ester impurity, which comes to be around 8 to 10% and is also not easy to remove. A big challenge of the process here is the removal of calcium. The calcium here comes from the choline phosphate. Choline phosphate is available as the calcium salt, this, which needs to be liberated, and this calcium is removed by its salt formation with oxalic acid as oxalate salt. The oxalate salt here is slimy product and it is not easily filterable. So in the plant is suitable equipment is required where this product is properly filtered fast. If the production is slow, chokes the filter and the product citicoline keeps converting back to the starting material citicoline over a period of time. So that is a problem which needs to be addressed here. The challenge of chloride and sulfate control also comes up. Chloride limit for in Indian pharmacopoeia is 500 ppm and for USP is 150 ppm, which is substantially low. And sulfate is not present in Indian pharmacopoeia, but in USP it comes like 200 ppm for the API. Chloride comes from the HCl that is used in the process, and sulfate essentially is from the water or the carbon which contains some sulfate. And usage as it requires a lot of equipment, and a dedicated plant is required for making this product. For injectable citicoline, the sterile API, an additional test of transmittance has to be met, and transmittance limit is not less than 97% transmittance. So this is another challenge for the injectable API, and most of the APIs available in Indian market do not meet this criteria. Another special treatment has to be done for this product. Now I come to the historical chemical approaches just to give an idea how this product has developed over time. Development had started taking place quite early, like in 1956. Kennedy and Khurana had reported this synthetic route, and essentially, this is the same synthetic route that is being followed even today in the commercial manufacture of citicoline, both in the Indian and the Chinese market. So, this has not been replaced, even though several further developments have been done. This is the most successful route of synthesis. Here, they have used DCC for coupling cytidine monophosphate and choline phosphate calcium. First, what forms is the morpholidate amide of CPCC, and it is coupled with CPCC in presence of DCC to form citicoline. In these patents, it has been a reverse approach. Like in previous, it was the morpholidate amide of cytidine monophosphate. Here it is that of the other starting material, that is choline phosphate. This choline amide of choline phosphate is reacted by with CMP to form citicoline. Here the disadvantage is being use of orthochlorophenol as the solvent and elevated temperatures. However, the yields have not been good in this route of synthesis. Another synthesis was reported in 1989 by Yurkevich. Here, the cytidine monophosphate was phosphorylated with POCl3 to obtain phosphodichloride, and this phosphodichloride was selectively hydrolyzed to retain one chloride. This chloride on reaction with morpholine again produce the same cytidine monophosphate morpholinamide, and this morpholinamide reacts with CPCC to form CT. So this is an interesting approach, but the yields here are not reported to be very good. There are certain modern synthetic innovations that have taken place in this molecule. They have used certain newer type of reagents to produce this molecule, 2-imidazole 3 dimethyl moiety, and these are costly reagents, though they produce the product, and the yields also have not been reported to be good, though the attempts have been made to make this molecule by different procedures. This is another synthetic uh, method by Wang et al. In 2015, where they are using dicyanoimidazole in N-methylpyrrolidone solvent. Both these are expensive reagents, hence this doesn't fit in the cost criteria for this product. So this is not a viable method to make the product. Kawashima et al. In 1971 had reported a simpler method using Wilsomer Heck reagent, that is thionyl chloride plus DMF for coupling instead of DCC. The product was isolated using ion exchange chromatography, but the yields reported are around 60%, which are substantially low. So this is not at all used. Gezal et al. Have used CDI for coupling instead of DCC. CDI as all the process chemists are aware is an expensive reagent. So raw material cost of this API itself is around 4,000 rupees. CDI is not a viable route of synthesis. Chen's morpholine approach is an interesting one where they reacted morpholine itself with POCl3 to produce phosphodichlorodate as given here. And this phosphodichlorodate is reacted with cytidine to obtain the same amide, CMP morpholine amide, which is further coupled with CPCC to get citicoline. However, the yields have not been good in this route of synthesis. This is just collection of what the reagents various researchers have used for making this. Here it is the timeline, how the development over the time has taken place. And the purification strategy is essentially formed only in use of activated carbon and the types of resins. There are different resins that have been reported for the purification in the column. There are some are simple resins, some are ion exchange resins, and rest of the people used activated carbon for the control of impurities, mainly cited in monophosphate and methyl ester impurity. Synthetic strategy which the Indian pharma companies use is the same as the Chinese, in fact. However, the process differs in the isolation of the product. Indian pharma industry use carbon mainly for the removal of the impurities. Impurities get adsorbed on the carbon and get removed, and the solution further is crystallized to obtain citicoline, while the Chinese use resin column for the purification. Purification means removal of cytidine monophosphate and the cytidine monophosphate methyl ester impurities. The disadvantage of using carbon here is the carbon also takes away a lot of citicoline sodium which gets absorbed onto there is a substantial yield loss during the purification. So that is a big disadvantage, lower yield in carbon purification, while the resin procedure gives a better yield than the carbon, hence the cost of citicoline is also low. However, when the resin column is used, substantial amount of water is used to elute the column, which has to be removed in the process, and that causes at least some effluent and complications. But the yields are better in the resin column process. Thanks for listening to this and have a good day.